Hello everyone, and we have a proud Damsonian, Dr. Akashdeep Singh. He has secured a very good rank of 198 in NEET PG 2019. Heartiest congratulations, Akash, and very well done.
Thank you, ma'am. Thanks.
How do you feel?
I feel excited and relaxed at the same time, and I'm on cloud 9, I guess, right now.
Yes, you absolutely deserve it, because we shouldn't forget that this is a rank from out of 1.5 lakh candidates,
yes,
and it's not an easy task, and you would be a very good Delhi state rank as well,
yes,
which would be approximately how much?
11, I guess.
So which is amazing, a state rank 11. So wonderful, and since you've done so well, people would really want to know how to achieve a score like this, right? So Akash has been a student with us for past 3 years. He's done the foundation classes, and then has followed it up with test and discussion course. And Akash, I would like to start on this note only, that when you started your classes, how valuable do you think they've been in your preparation?
Ma'am, they were the main item which I had for preparations. I was particular about that I will follow DAMS blindly, and I was very particular in my 3rd year only that I will make proper notes so that I can study it well from my notes only. There are many people I see which do photocopy notes, which I don't like personally, because the way they teach you, you add your points, you add stories which you tell.
Right.
The stories Sumer sir tell, the story
clinical
you tell.
Examples.
Yeah, clinical example you tell. Then it correlates well. So it's not about reading all the same stuff again and again, but you have to apply it as well.
And do you agree that it helps in integration with the other subjects?
Yes, ma'am, exactly. And it's all about integration, I guess, also in the Central Institutes, and it's coming into NEET also. You don't get direct questions these days.
Yes, especially if we talk about part C, which was clinical.
Yes, ma'am. Yes,
it was not just one-liners. It was good clinical questions.
Exactly, ma'am.
Right. And once you attend the classes, do you think they were helpful in your professional exams as well?
Yes, ma'am. I used to revise them in my professional examination. Like in 3rd year, tried to revise as much as I can, but not, of course, all things. But I did ENT and all, which were the professional exams. Respective years. Yes. I did it that way.
And that's amazing, because that way you've already sort of done your notes thoroughly once, and that saves a lot of energy for your internship year.
Yes, ma'am.
And that is why you're able to crack it right in the first go.
Yes, ma'am. And also I used to add some textbook points also. I used to read standard textbooks as well, and they also helped us. They always tell us at DAMS also that you have been told the main crux, but you have to give an extra shot to have a good rank. So I added some of my stuff in my notes only, and I tried to revise as many times as possible.
Okay.
That was my main motto.
Right. And Akash, because once you do the foundation course, your NEET exam is 2 or 3 years hence.
Yes, ma'am.
Right. And that is why I think you decided to do a test and discussion during your internship as well.
Exactly.
So do you think that the T&A course during your internship was good to give you the updated information, the current pattern of the exam, the type of questions?
Yes, ma'am. Exactly, ma'am. First of all, we get the updates also. We know how to appraise question, because in the paper of 300 questions, not all the questions you will be knowing. Around 150, 200 you can, I guess. But after all, you have to apply and see, and you have to rule out options.
Absolutely.
You can't get the right answer instantly. So you have to think, and that capacity I got from the test we had in TNDs, and they also gave me a time period at which I have to complete my particular subjects. So if I'm lagging behind, I know I'm lagging behind, I have to push it myself. And that was the main thing. TND gave me a schedule to follow, and then CBT was also very great experience.
Yes, because if you follow the TND schedule, you will automatically finish your first reading by some time. And it gives you times to do the multiple revisions after that.
Yes, ma'am. Yes.
Right. And so TND is a subject paper, and what about the grant test? Do you think you should give them, and you should give them from early, and how to utilize the grant test?
We should give it early. I started a bit late, I guess. I started in August, I guess.
Okay.
But it was a bit late, I guess. But you should start as early possible, because it doesn't matter if you have to correlate mainly. You have to integrate subjects. It won't be a question that you can say it's a biochemistry question. But biochemistry questions like Wilson disease can also come in medicine also.
Yes.
So you have to integrate both these stuffs in one go, and also radiological questions, anatomy. So the correlation is the main thing to go and build your concepts, I guess, mainly.
Right.
So that helps grand test, and the videos the DAMS provides in grand test. I didn't have the time to do all the videos, but as internship was very hectic in MAMC, so I tried to the questions I got doubt in, I used to go there and see the videos there, and it helped me a lot to clear my concepts, which are very good, very important for cracking any exam.
So I think you basically utilize the videos for areas that you were typically weak in.
Yes, ma'am.
And did it help you to reduce your negative questions?
Yes, ma'am. When I gave the GTs, I got to know that I am lacking in subjects.
Right.
Like maybe any subjects, maybe for that, maybe anatomy,
yes,
or maybe ophtha. So I went back, I saw the ophtha video for that, and it's not like they give you answer directly. They tell you the whole thing about it, the 4 options, and they tell how to tackle and
how to rule out.
Yes. The main thing I think the ruling out option is a thing which I learned. I don't know, I have learned till now very good, but Sumesh sir is always telling us that you can't be knowing everything. You have to rule out, you have to be aggressive, you will get good rank. So I always was very aggressive with my attempts, and I was always trying to be good at ruling out options.
That's great. And Akash, since the course is pretty vast,
yes,
you have 19 subjects to do, and I believe revision would have been an important part of your preparation as well. So what was your revision strategy, and how did you go about it?
Mainly I tried to cover the final year subjects in the final year, and then I did the TND and got updated as well. Was not able to complete revision of again and again of final year subjects, as I thought that I was weak in a particular area, maybe first year, second year, that's different for different people.
Right.
But I was weak in those areas, so I dedicated more time to them.
Okay.
Then I did their SWTs, and that helped me to gain confidence about their subjects.
Yes,
and
because again the SWTs come with videos, so
yes, ma'am.
They tell you not only about that question, but also things that you should know around it, and that helps.
Keep on revising also in the mind. So it was very good to have these facilities here. So it was very easy to me. I guess we are very lucky enough to have DAMS. I told you also the DVD session. I was amazed to see that experience in Talkatoro Stadium. I was attending it live, and also when I saw the you and Sumesh sitting and listening to the listening to the
we are
teachers.
Equally eager to learn in that session.
It showed the passion you have for this teaching, and it also motivates us to perform to the best capability we have.
Yes, motivation is very important in these stressful times, because you are under pressure and you have to perform. So little things keep you going.
Yes, ma'am.
And since you mentioned about DVT, Akash, we would want to know, was it useful for you? Because this time you did have good number of eligible questions in the NEET exam as well.
Exactly. DVT was very helpful. First, most important thing was in 3 days you get to cover all the 19 subjects you have.
So it's like a rapid revision.
Very rapid revision. And it was very good. It was exhaustive, but I felt very good. At the end of it, I knew I had some weaknesses because I was not able to grasp everything in the class. So I knew I had to work them out soon as possible because the paper was coming soon.
Yes.
So on that, DVT told me that you have to concentrate more on the weaknesses, and my strong subject will be remaining strong because I have concept in that. So I started to build on my weaknesses mainly.
Right. And how important do you think is the testing part, and then testing part, and that too in the format in which you're supposed to do like CBT?
Yeah, ma'am. CBT was excellent. I have no words for that. It gave me the confidence that I will definitely be in a very good college for sure. I got very good ranks in both CBT, so I was definitely sure that I will be doing good.
Well.
And it was like it's a preparation part. And when I went to NEET, it wasn't like it's a new situation. I was not that much anxiety, I would say. There was slight anxiety, obviously. That's a very big exam for me, for everybody, for us. So it strengthened me and gave me the confidence to go for my instincts and mark like I usually do in GTs and CBTs.
Wonderful. And do you think that we try and support you people through the Facebook group as well? So do you think that this all-round information is good enough for you to crack an exam?
It's more than enough, I guess. If you can learn regular things which DAMS are telling you in class, then that's already enough, I guess. Because there's only a small bowl you can grasp, I guess,
that's
and
very
you can
true.
overfill it. So
And you know, people like you and everybody would say that
ma'am.
internship it's difficult, but I
Yes,
would say
ma'am.
that it's actually a blessing in disguise, because
Yes,
when you
ma'am.
have less time, you tend to do only things which are high yielding, and that's what
Yes,
you're
ma'am.
supposed to
Focused,
do. You have
it
to
is.
concise your
Yes, ma'am.
material and read what is more likely to be asked in the exams.
Yes, ma'am.
Right?
Yes.
And now coming to close to the exam, say a month before the exam,
ma'am.
what kind of revision did you focus on?
Ma'am, I mainly started from the weaknesses again,
Okay.
and then I wanted to revise my weaknesses twice before the exam.
Okay.
And my strong subjects were like I will do just rapidly, flip through them. But main thing I was focused upon my weaknesses, that if a subject is more scoring, I
Okay.
need to get more score in that.
Definitely.
Like I think ops and gynae notes of yours is more than enough. It covers more than 90%. I guess maybe 100%. I don't know the.
And there's quite a extensive number of questions being asked.
Yes,
from
ma'am.
the
The
topic
ops.
as well.
Yes, ma'am. So I devoted myself before 2-3 days to ops and gynae also, because you know it was scoring, and you have taught us so well that I will score good. I don't know how much I scored in ops and gynae, but definitely it was good enough, I guess. So I was very grateful to all of you, especially you and Sumer sir, those especially.
That's very kind of you. Thank you, Akash. Akash, now something about the exam strategy. How many questions did you attempt, Bacha?
Ma'am, I'm always being aggressive.
Okay.
I attempted 299 in NEET.
Wow.
So I think my friends told me that you were too much aggressive, but that's the way I do my papers
But
all the
that's
time.
what has
Yes, ma'am.
always worked. And I
Worked
think
for
it
me.
has worked even now.
Yes, ma'am. CBT also, I attempted these much questions and I was in top 100. So I was.
And you've quite replicated your rank.
Yes,
there.
ma'am. Yes, ma'am. Definitely.
Wonderful. So, yes, because even the topper is going to do a few things
Yes,
wrong.
ma'am,
So,
for sure.
And I think the negative marking in NEET is not very,
Yes, ma'am.
not so much that it should refrain you from attempting
Yes,
the
ma'am.
questions. Right? And anything that you want to comment on, what subjects should you primarily focus on when you do NEET, or is it like an all-round?
It's becoming, I guess, an all-round thing.
Right.
I guess the basic sciences subject, the first and second year, are very scoring,
Okay.
and you can definitely score more than 80% in them if you have studied them well. And plus PSM, obstetrics, these are the subjects, and some short subjects also. If you are
Right.
good, like I want to pursue in ortho most
Okay.
likely, so I studied ortho very well. So I knew that is my strong subject, so I revised it. So I thought short subjects for second year and obstetrics and PSM are the main things you can go with ahead, and the rest can fall into place if you have good concepts.
Okay, great. And anything special that you want to say during the entire phase of preparation, right from the beginning to the end, that a candidate must focus on?
Ma'am, I want to tell everybody that life will be of ups and downs in all ways, but you have to focus at your main target, and
Right.
DAMS helps you to motivate as much they can. I have seen so many videos that you come live, Sumer sir, sometimes you come live to motivate us to perform as well.
Right.
So that gives us an extra motivation that our teacher is so keen to us to perform very well. So that was a very big bonus, and you should keep trying, keep going hard. There will be falls, but step up and take your chance.
That's a great piece of advice, right? And if you have to sort of summarize the 3 most important ingredients required to crack the NEET PG exam, what would those be?
Ma'am, first of all, DAMS notes. Second, I guess confidence they should be there.
Right.
Practice as many GTs as you can. You will gain confidence from them.
Okay.
And go for your instincts, I guess. If you have worked hard for the last 4-5 years and you have studied textbooks, you will get instincts and you will be right, all of them. I changed my instincts in 3-4 questions. I was not happy by changing it. I got done wrong. I realized it later, but I'm happy overall. I got a good rank.
Wonderful. Yes, it is indeed a good rank, and I'm sure you will get whatever you wanted this rank
Yes,
at the place that you wanted
Yes,
it
ma'am.
as well.
Yes, ma'am.
So we wish you all the very best, Akash.
Thank you, ma'am.
For a very bright future ahead. May you be a great doctor.
Thank you, ma'am.
And thank you so much for being here with us today.
Thank you, ma'am.
Thank you.